Get started. I'm Nick. I'm one of the second years. It's February in Brooklyn, so what better time to talk about marine envenomations? So today we'll start with the case, talk about some different species and how they can injure you, the treatments, and then an overview. So a 25-year-old comes into your ED, no past medical history. He has this painful lesion on his leg. He said he was swimming off the coast of Australia. His vitals are here. He's tachy to 110. Blood pressure is a little elevated. And then you see this rash on his leg, and you think to yourself, I think I've seen this exact picture in Tintinelli's before. So you start thinking about, what species could have caused this. You start running through the list in your head. So first species I'll talk about is stonefish and scorpionfish. These fish live in tropical and warm temperate oceans in the Central Pacific, Indo-Pacific, and East African coastlines. The stonefish, because of its appearance, can camouflage in their environment, and the way you get hurt is from these dorsal spines that can stab you. Usually just involves localized pain, redness, swelling, lasts like 30 to 90 minutes, or peaks in 30 to 90 minutes and lasts up to 6 hours. Then you can have non-specific systemic things like nausea, vomiting, and syncope. And the toxin can cause things like seizures, paralysis, AV blocks, and even tissue necrosis. So the treatment always starts with local wound care. You can irrigate with seawater, give pain control. And the stonefish actually has an antivenom that you can use. It's made from horse serum. So you can give that, but you have to be prepared to treat anaphylaxis if you do. The next species is a stingray, and these are found in tropical and subtropical shallow waters. The way that you get injured is from being stabbed by these tails with these barbs on them that can inject a toxin into you. It's really only used for defense, so this only happens if they get stepped on or trapped. It's not like they use it for hunting or anything like that, or feeding. Again, injuries, usually just pain, edema, bleeding, depending on where you get stabbed in. You can have the toxin can cause systemic things like weakness, again, vomiting, diarrhea, muscle cramps, seizures, and arrhythmias. And treatment, you use hot water between 110 and 114 degrees Fahrenheit, and that can denature the protein, and that can relieve the symptoms in like 10 to 30 minutes. So Steve Irwin, he died by being stabbed in the chest from a barb of a stingray. So quick moment of silence for him. Thank you. The next,
Try to ride stick.
I don't think he was trying to ride.
Okay, fine. Or you can go in the water.
So the next species is a weaver fish. These live in the Mediterranean and off the European coast. They are bottom dwellers, so oftentimes they get stepped on, and that's when the barbs will stab you. Again, it's just hot water immersion, topical lidocaine, local wound care. And you have sea snakes. There's a lot of different species of sea snakes that can cause injuries. They're found in warm tropical oceans. There's not really many in North America except in Hawaii. The way you distinguish them from land snakes is they have flat tails and they have these valves that kind of cover their nostrils. And unlike eels, they don't have gills or fins. And they have hollow fangs with venom glands. That's how they envenomate you. And up to 40% of envenomations from sea snakes can be fatal. They have neurotoxins and myotoxins that affect the acetylcholine receptors. Their bites can be painless for like 30 minutes, and then you start to have severe pain for up to 4 hours afterwards. You can have things like myalgias, muscle weakness, vomiting, malaise, and worst case, rhabdo, weakness from neurotoxicity, and even respiratory failure. So treatment for this is you pressure immobilize the affected limb. There's a sea snake antivenom that you can use for systemic reactions. And then if respiratory failure occurs, you need ventilation, respiratory support. So the blue-ringed octopus is one that has it's a specific type of octopus that causes toxin with tetrodotoxins, the same as if you ingest a pufferfish. It's the same thing you probably heard about in medical school. The way you get injured from octopuses is from a bite, usually if you try to pick up or handle the octopus. And again, it's usually just local pain, numbness, paresthesias, but you can have severe reactions, again, flaccid paralysis, even respiratory failure. So similarly, what you do is pressure immobilize the affected limb, and supportive care, treat the pain, and then you watch out for things like flaccid paralysis and respiratory failure again. And they can often have these little like wounds that are painless at first, and then you see the symptoms arise afterwards. And there's no anti-venom available for this. So cone snails, these are found in shallow waters in the Indo-Pacific Oceans. They have these dart-like radicular teeth that they can inject into you. Oftentimes happens like if you pick it up, put it in your pocket or something, you just think it's a normal shell. Yeah, they can cause partial paralysis in short as 30 minutes that can progress and again cause respiratory failure. And treatment is similar again, irrigate with seawater, pressure immobilize, treat the pain, and monitor for signs of respiratory failure. So sea urchins, they kind of can be in any ocean. They have these sharp calcified spines that can contain venom. Again, they cause local pain, myalgias, and skin where they stab and they leave these little black marks from where they inject in. You can have systemic symptoms like nausea, vomiting, paresthesias again, respiratory distress, and the treatment is pretty much the same as the rest of these ones that stab you: pain control, seawater to irrigate, and then hot water immersion. Starfish, specifically this crown of thorns starfish that's pictured here, that's the species that's venomous to humans. They're found in the Pacific, Indian, and off the Red Sea and the coast of California. They have these spines that can stab you, and they inject histamine-like compounds that cause pain, bleeding, paresthesias. It lasts about 3 hours. Similarly, you irrigate, treat with hot water immersion. You can use topical lidocaine. And for this, you can use systemic corticosteroids. So those were kind of the species that stab you to cause injury. Now we'll move on to things that sting you, like jellyfish. The way you get injured from a jellyfish sting is they have tentacles with thousands of these things called nematocysts on them, and that's what contains the venom. And when you touch them, there's a physical or chemical reaction that releases a sharp tube from the nematocyst, and that's what penetrates the skin and delivers the venom. Kind of depends the species of jellyfish, what the reaction is, and how big the dose of venom is. But the most universal treatment is to irrigate with vinegar, seawater, again, hot water immersion, lidocaine, pain control. So the box jellyfish is a specific kind of jellyfish that causes this Irukandji syndrome. And what it is, you get stung, you have pain and redness, and this progresses to generalized pain, like your back, abdomen, chest. And then you see signs of catecholamine excess, like tachycardia, hypertension, piloerection, agitation. And the jellyfishes can be like an inch long, so you might not even see it in the water, know what happens, and then you feel this injury. The most severe reaction would be cardiogenic shock, pulmonary edema. So what you do first for this is you irrigate, you remove the tentacles, you can kind of scrape them off with something, and then you look out for signs of, cardio shock, resuscitate. And for the box jellyfish, there's a specific antivenom for the Australian species, the Chevronic species that you can give. And that's the specific wound that you see, we saw earlier in the case. And lastly, the Portuguese man of war. It's not actually a jellyfish. It's actually a siphonophore. It's a species of animals that's closely related to jellyfish, but not really a jellyfish. They have these long tentacles up to 30 meters long, again, filled with these nematocysts. And you can get stung even from like a severed tentacle that can just remain active for a couple months. This causes this typical linear eruption called the string of pearls pattern that you can see on the photo up there. This venom is heat labile, so you can use hot water immersion. Again, you remove the tentacles, scrape off the nematocyst, and treat the pain. So you go back to the case, you see that reaction, you suspect a box jellyfish sting. Oh, sorry. And so you start irrigating with seawater, you submerge in hot water, you scrape off the little nematocyst. You treat the pain, you see his vitals aren't really getting any better, so you decide to give antivenom, and you just monitor him, doesn't show any signs of respiratory distress, feels better, you discharge him to go back to the Australian Sea. So things to take away, just want to know what species are around you, know what's dangerous, treatment for things that stab you, pretty safe to irrigate with seawater, and that should help. Things that sting you, use vinegar. And, can't go wrong doing irrigation, hot water immersion, and just paint control. There's only very specific anti-venoms for certain species that you can use. So I guess you'll just have to know that if you're around you. And Steve Irwin rocks.